Hey there, students. Ben and Sandra here, and presenting on Native Americans and trying to get a deeper understanding of their beliefs and how that affects the care that we're going to provide. So the objectives for this presentation are going to be to recognize the importance of cultural competence and how this can impact the care that we provide to Native Americans, to analyze the prevalence of this group of people in the United States and where specifically they reside, and then to review a brief background about Native Americans and some of their customs, beliefs, traditions, and culture. And then we're going to take a look at how some of these factors can affect providing care to this group of people in the healthcare setting. So in the second half of this presentation, Sandra is going to present on these objectives. She's going to analyze some of the more common health concerns affecting this population and how those statistics compare to those of the United States. She's also going to review each pertinent body system that is impacted in the Native American population. And finally, she'll help you guys understand the anesthetic implications that are unique to caring for the Native American population. Nagel Health defines cultural competency as a strategy to address disparities and improve outcomes requiring healthcare providers to be both respectful and responsive to the health beliefs, practices, and needs of diverse populations. The terms Native American, American Indian, and Alaskan Native denote one of the smallest racial groups in the United States. This group of people represent the original indigenous people of North America before the United States ever became a country. You will see in these slides and the following slide that there are some discrepancies in the numbers of total population in the United States and the total number of Native Americans related to the total population value. This is due to utilizing different sources as well as using information from years of 2000 all the way to 2014. Although the numbers are different, I think the key point is that Native Americans who were once the dominating residing group in the United States, really all of North America, have now become the minority. The US Census in 2000 reported that of the 281 million persons in the United States, only 4.1 million reported that they were American Indian or Alaskan Native. Interestingly, that 4.1 million value was made up of more than 500 different individual tribes. Among the tribes include Plains Indians such as the Apache and the Sioux, the 5 civilized tribes such as the Cherokee, the Choctaw, and the Seminole, the Pueblo such as the Navajo and the Zuni, and the Alaskan Natives, which include the Eskimos. Although the number of Native Americans seems sparse, since 1970 the Native American population has actually increased by 140% due to more individuals claiming Indian heritage. As you can see in this picture on the right, as many as 36 states have Native American state population of less than 1%. There are 7 states that have a state population of more than 3% Native Americans. The states with the largest Native American population in the United States are California, Oklahoma, and Arizona. Of the total population of Native Americans in the United States, roughly 43% live in the West, 31% in the South, 17% in the Midwest, and 9% in the Northeast. Again, the numbers are only relevant in this presentation to show the relationship of the total United States population to the current population of Native Americans. I actually found that the current United States population today is roughly 325 million. So these numbers are a little low given that they came from roughly 10 to 15 years ago. In this picture, you can see that the white population makes up 75% of the United States total population compared to the Native American population that is roughly only 1%. Understanding the Native American belief system can be an important factor in providing culturally competent care. The Native American religious tradition is one of oral tradition that does not include a central figure such as Jesus, Moses, Muhammad, or Buddha. Classic Native American beliefs are passed down from generation to generation and are based on certain guiding principles that are internalized from childhood and are a pillar of each person's life. It is important to note that not all Native American groups believe in the same thing, and not all Native Americans continue to follow beliefs of their ancestors. Some may adopt more modern beliefs or have a mixed belief system being made up of classic beliefs and more modern beliefs. One common theme in the Native American belief system is the belief in the Great Spirit. The Great Spirit is said to be a part of all creation, including in the wind and the water, and the plants and the trees and animals and so on. So Native Americans also share a common belief that there is one single creator of the heavens and the earth, and that the creator is never punishing but always loving and just. Morals and ethics, beliefs, cultures, customs, religious, and sacred traditions are passed on through an oral tradition and through ceremonies. Some of these include dancing, singing, drumming, prayer, worship, feasting, purification rites, fasting, and physical ordeals. Commonly, the relationships are more important to the Native American groups, so much so that decisions will be put off if agreement cannot be reached between family members regarding the care of a loved one. Family will include many extended family members and friends. Elders are to be respected and are often listened to when decisions are being made. Balance is an important concept in the homeostasis of Native Americans. Illness occurs when life is out of balance. Coens equatus is a term used when life is out of balance. Well-being or wholeness comes about through walking in harmony with the forces of nature and the universe. Illness is a sign of having fallen out of step with those forces, and thus causing disharmony in the spirit, mind, and body. The most important element, the essence of our being, is the individual's spirit, and for wellness to occur, the spirit must be considered. For this reason, a Native American with a broken leg may seek treatment not only from a physician to care for the physical injury, but also from a medicine man or woman to care properly for the spirit. Medicine men and women, shamans and healers, are those who have been given a special gift by the Great Spirit to help mediate between the spirit world and the earthly realm. It is common for the medicine men and women, shamans and healers, to be an active part of the care in a Native American along with Western medicine healthcare team. Many traditional Native Americans believe that illness comes from supernatural forces. Examples are the Cherokee believe animal spirits bring illness when hunters do not pay respects or proper respects, and the Iroquois believe illness is caused by unfulfilled desires and dreams. So please review this slide here for some of the issues that you may see on an everyday basis, such as issues with blood transfusions and even organ donation. So medical and nursing care, I found this slide rather interesting, just with some physical things and even social things you can do that are more acceptable to the Native American population. So go ahead and review these on your own, and I'll see you on the next slide. So to continue from what we just saw on the last slide, here's a couple of more things to keep in mind when dealing with the Native American population. So items such as stones, feathers, antlers, claws, leather or cloth pouches can all be considered sacred items, so do not touch these items if possible. And if there's an emergency, be sure to keep these sacred items with the patient if possible. A woman's moon time or a menstrual cycle is considered an important time of power. A woman may not participate in some ceremonies on her moon. When a ceremony is being performed in the patient's room, leave the room and attempt to allow them privacy. Only stay in the room if you're invited to stay. Ask for permission before taking any photographs such as x-rays, CTs, MRIs, or any type of other imagery. Take the extra time to explain the reason for these pictures to the patient and their family. If the person is in need of an amputation of a body part, ask what their tradition is and what they may require afterwards for body parts that is removed. Some may request that the body part is blessed and then followed by cremation in order to be buried with them at the time of death, or they may need it to be buried as soon after the surgery if the body part is not being cremated. It is not uncommon for Native Americans to deny their pain. They may decide not to talk about their pain because it's hard for them to accept the fact their bodies are failing. Patients may appear apprehensive to taking medication due to the fear of addiction. Take time to explain healing can be quickened if pain is managed. Talk with the patient to find out their preferences for managing their pain. Pain management can be managed at the hospital and or at home. If the patient is dying, they may want to go to their creator with a clear and open mind. Patients may not believe in medication due to their belief that the creator will heal them through traditional healing practices. Caring for the elderly in their homes is seen as important and as a necessary part of life. Children and elders are supposed to be together. It is through our elders that individuals are taught the full circle of life, which includes death. If the patient needs care at home after being in the hospital, family members should be trained to take care of the patient. Time should be taken to explain the procedures, utilizing hands-on experience to make sure they fully understand the process. Smudging with sage, cedar, and sweetgrass may be desired. To smudge is to spread the smoke of a burning herb over a person, space, or object for purification. If smoke is not allowed, smudging the oils for sage and sweetgrass and cedar may be used as a substitute. Tobacco ties are small cloth bundles that contain tobacco, which can be given as a sign of friendship, tied on a string, or tied on a branch to carry prayers. Feather ceremonies might involve the sweeping of a person or body with feathers, the tying on of feathers, or the handling of feathers in prayers. Face paint may be part of a ceremony to prepare a person for surgery or death, or may be a part of the care of the body after death. Healing herbs, oils, roots are often used for spiritual and emotional healing as well as part of the treatment of physical condition. Providers are encouraged to consult the Native American practitioners to integrate these treatments. Pipe ceremonies may be performed by a spiritual leader either in the hospital or outside on behalf of the patient. When possible, arrangements should be made for the pipe to be smoked with the patient. When conditions do not allow for smoke near a patient, the spiritual leader may have the patient pray with the tobacco and the pipe before going to smoke it elsewhere. Chantways and songs with drum or rattle are a daily part of healing for many Native Americans. The visit by a tribal singer is emotionally very healing for the patient. A patient may have an audio tape of a prayer song that they want to hear regularly. The drum represents the heartbeat of Mother Earth. The sound of the heartbeat is the first sound that people hear when he or she is in their mother's womb. The shake of a rattle is associated with medicine ceremonies. The sound of the drum or shake is associated with healing prayers, and we reassure the patient that they are not alone nor forgotten. Crystals and sacred stones may be used as part of the healing. Crystals may be laid on a person's body or may be held for prayers. Sometimes a crystal is prayed with in the 4 directions in place of the pipe. Sacred stones may be held in prayer. Fasting is a traditional part of preparation used in rite of passages or other ceremonies. If necessary, fasting can be done by family members on behalf of the patient in situations where the patient cannot go without food. Fasting is often considered necessary in the healing process and removal of toxins from the body. There are a vast number of rituals that mark the passage from one stage of life to another to help keep the individual on the path and to bind them to their family and their community. Keep in mind the belief that life is not just a physical journey, but a spiritual one as well. The ceremonies marking life's passages vary widely from tribe to tribe. However, most groups value each stage of life and mark it with a ritual or in celebration. Here are some of the more common rituals for beginning of life. Go ahead and review these on your own, and I'll see you on the next slide. Here are some end-of-life things to know when taking care of a Native American or their family. The body should not be moved until the family has been consulted about their particular tradition. Special clothing may be brought to dress the body in before it leaves the hospital, or the family may request that their loved one be covered at the time of death by a blanket. Particular ceremony objects may be placed on the body. It is often customary for a family member or the spiritual leader to cut a piece of hair from the deceased. This is, for some tribes, especially important at the death of a child. Traditional persons do not generally desire embalming and may require significant lengths of time with the body. Traditional families may wish to have the body near them for as long as 4 days. It is critical to talk with the family about their particular tribe traditions. For example, the Navajo people destroy the clothes and possessions of the dead person and are careful not to speak the dead person's name because to do so might attract his or her wandering ghost or spirit. On the other hand, some tribes will make special ceremonies of giving away the deceased person's possessions and will repeatedly speak the person's name after death as part of the ceremony.
We're going to move on and talk about health disparities and anesthesia considerations. The history of trauma has resulted in intergenerational trauma among Natives. Children being forcibly removed from their homes to be raised in boarding schools still impact how parents raise their children. Indigenous people experience higher rates of substance abuse and related disorders like PTSD and suicide, all of which are directly associated with this intergenerational trauma. American Indian and Alaska Natives born today have a life expectancy that is 5.5 years less than the average U.S. population. 1 in 8 adults require substance abuse treatment. 16% of Native students have reported suicide attempts in the past year, and 56% of Natives are more likely to die from alcohol-related causes. Other health disparities continue to be an issue. Natives are 30% more likely to have coronary artery disease, 20% more likely to be smokers, and are more than twice as likely to have diabetes than non-Hispanic whites. Nearly half of all Native adults are obese. Lower life expectancy and the disproportionate disease burden exist because of inadequate education, disproportionate poverty, discrimination in the delivery of health services, and cultural differences. Diseases of the heart, malignant neoplasm, unintentional injuries, and diabetes are the leading causes of American Indian and Alaska Native deaths. High blood pressure, diabetes, and arthritis were the 3 leading chronic conditions for AI and AN elders. However, other chronic conditions among elders also occur at double the national average. In this population, we should appreciate the multitude of risks involved in the care as they relate to anesthesia. Diabetes, CAD, alcoholism, smoking, gene mutations, substance abuse, use of herbal supplements, arthritis and obesity are some of the most important considerations when completing a preoperative interview. In the patient with diabetes, it is important to assess the hemoglobin A1C and to understand that there is a high incidence of ischemic heart disease in this population. Exercise stress testing and a 12-lead ECG may be warranted. The potential for renal disease and electrolyte imbalances exists. Autonomic dysfunction may present as orthostatic hypotension, resting tachycardia, lack of respiratory variability on a cardiac rhythm, and gastric paresis. Administration of a gastrokinetic like metoclopramide can reduce the incidence of regurgitation and pulmonary aspiration during general anesthesia. Maintain a serum glucose to less than 180 intraoperatively and delay a case in severe hyperglycemia due to mortality risks. It is wise to minimize fasting period and schedule cases as early as possible. Pre-existing neuropathies are common in diabetes, so these patients are at a higher risk of nerve injury. The revised cardiac risk index, pictured to the right, offers an improved predictive risk index for major postoperative cardiac complications. It is the simplest and most widely used. Whenever a patient has signs of significant disease, referral to a cardiologist is indicated for assessment and possible intervention. As with any patient, those with good functional capacity or a METS greater than 4 can proceed for surgery provided that the patient with risk factors is properly managed with a statin and beta blocker therapy. Alcoholism is a major anesthetic consideration in this population. The American Psychiatric Association estimated that Indigenous people are 526% more likely to die from alcohol use than are non-Indigenous people. Abstaining from alcohol for more than 4 weeks preoperatively helps to decrease complication rates. Chronic alcoholism can lead to changes in anesthetic requirements, exaggerated responses, prolonged drug effects, and high bleeding risks. Adults are 20% more likely to be cigarette smokers than non-Hispanic whites. Native children are 60% more likely to have asthma than non-Hispanic white children. Exposure to secondhand smoke is very high in all of these age groups, even in non-smokers and pregnant women. This places the patient at risk of the following: laryngospasms, bronchospasms, sputum retention, hypoxemia, baro and volute trauma, reintubation, and postoperative atelectasis. Smoking cessation should occur at least 12 to 48 hours preoperatively. Native populations may be at higher risk for the development of malignant hyperthermia. This is due to a specific STAC3 gene mutation, which normally functions to provide skeletal muscle excitation and contraction. This presents as Native American myopathy, or NAM, an autosomal recessive congenital myopathy. It includes symptoms like muscle weakness, contractures, progressive scoliosis, early ventilatory failure, a peculiar facial gestalt with mild ptosis, downturned corners of the mouth, short stature, and the susceptibility to malignant hyperthermia. A pre-op interview with a thorough history is critical in identifying this risk. Volatile anesthetics and succinylcholine need to be avoided. Core temperature monitoring should be implemented. The anesthesia machine should be flushed with oxygen set at 10 liters per minute or greater, and the CO2 absorber should be exchanged in the preparation for the case. The anesthetist should plan for a total intravenous anesthetic or a regional or neuraxial anesthesia. Recovery treatment is largely unavailable to Native populations and access to primary care is limited. Suicide is often the result of the failure to treat such problems such as depression, alcoholism, and domestic violence, all of which occur at higher rates in the Native communities. Suicide is the second leading cause of death for Natives aged 15 to 24 and plagues all tribes. A patient with a history of substance abuse should be evaluated the day before surgery. Preoperative substance abuse will lead to cancellation of the surgery. A distinction between long-term and acute substance abuse must be made. A urinary drug screen should be performed in patients suspected of abuse. The patient with signs of acute intoxication is an inappropriate ambulatory surgery candidate because of the increased likelihood of impaired autonomic and cardiovascular responses. Regional or local anesthetic techniques, if their use is suitable to the surgeon and the procedure, may be used if the patient wishes to abstain from sedatives and opioids. Postoperatively, pain may be minimized by using local wound infiltration, regional anesthesia, and prophylactic use of nonsteroidal analgesics. About 47% of American Indian and Alaskan Native adults have arthritis. Sometimes this consideration is overlooked. This includes considerations of osteoarthritis, ankylosing spondylitis, and rheumatoid arthritis. The chronic pain and inflammation of spinal or extraspinal joints associated with these diseases limit the degree of mobility. Tolerance for positions required during surgery and regional anesthesia techniques should therefore be ascertained preoperatively. The patient with arthritis can have difficulty with positioning of the head, especially during intubation, restrictions in vocal cord movement, restrictive lung disease, and a very high risk of extremity or nerve injury. Emergency supplies should be available in the event of a failure to ventilate or intubate scenario. Particular attention is given to airway evaluation to determine the likelihood of a difficult endotracheal intubation. Patients who are obese, have short, thick necks, or have obstructive sleep apnea have a higher incidence of difficult or failed endotracheal intubation than the general population. The patient should be questioned about the use of drugs such as amphetamines, non-amphetamine Schedule IV appetite suppressants, and antidepressants like fluoxetine and sertraline. You should assess the BMI, use a stop-bang questionnaire, assess for CPAP or BiPAP use, restrictive disease, and complete a complete airway assessment.